Hello everyone, this is Carrie and hope you all doing well. In today's video, I'll be talking about how to recognize and manage a blood sugar spike. So if you like the video related to my health, I would like to request you all please to subscribe the channel, hit the bell icon and give thumbs up so that I will come up with more and more videos with lots and lots of information. So here we begin, let's go. Blood sugar spikes are caused when a simple sugar known as glucose build up in your bloodstream. For people with diabetes, this happens because of the body inability to properly use glucose. Most of the food you eat is broken down into glucose. Your body needs glucose because it's the primary fuel that makes your muscle, organ, and brain work properly. But glucose can't be used as fuel until it enters your cell. Insulin, a hormone produced by your pancreas, unlocks cells so that glucose can enter them. Without insulin, glucose keeps floating around in your bloodstream with nowhere to go, becoming increasingly more concentrated over time. When glucose builds up in your bloodstream, your blood glucose, blood sugar level rise. Long term, this causes damage to organs, nerves, and blood vessels. Blood sugar spike occur in people with diabetes because they are unable to use insulin effectively. Untreated high blood sugar can be dangerous, leading to a serious condition in diabetic called ketoacidosis. Chronic high blood sugar increases the likelihood of serious diabetes complications like heart disease, blindness, neuropathy, and kidney failure. Blood sugar spikes symptoms. Learning to recognize the symptoms of hyperglycemia, which is a high blood sugar, can help you keep your diabetes in control. Some people with diabetes immediately feel the symptoms of high blood sugar, but others go undiagnosed for years because their symptoms are mild and vague. Now, the symptoms of hyperglycemia typically begin when your blood glucose goes above 250 milligrams per deciliter. Symptoms get worse the longer you go untreated. Now, the symptoms of blood sugar spike include frequent urination, fatigue, increased thirst, blurred vision, headache. Blood sugar spike, what to do? It's important to know the symptoms of hyperglycemia if you suspect that you have high blood sugar. Perform a finger stick to check your level. Exercising and drinking water after eating, particularly if you have consumed a lot of starchy carb, can help lower your blood sugar. You can also use an insulin injection, but be careful only to use this method while closely following the recommendation of your doctor regarding your dose. If used improperly, insulin can cause hypoglycemia. Now, the ketoacidosis and ketosis. It's also important to understand the difference between ketoacidosis and ketosis. If high blood sugar levels go untreated for too long, glucose will build up in your bloodstream and your cell will be starved for fuel. Your cell will turn to fat for fuel. When your cells use fat instead of glucose, the process produces a byproduct called ketones. People with diabetes can develop diabetic ketoacidosis, a potentially deadly condition that causes the blood to become too acidic. Because of poorly functioning insulin, people with diabetes, ketone levels are not kept in check and can rise to dangerous levels very quickly. Diabetic ketoacidosis can result in diabetic coma or death. People without diabetes can tolerate certain level of ketones in the blood known as ketosis. They do not go on to develop ketoacidosis because their bodies are still able to use glucose and insulin properly. Properly functioning insulin helps keep the body ketones level stable. Ketoacidosis is an emergency that requires immediate treatment. You should call 911 or seek emergency medical attention if you experience any of the following signs and symptoms: fruity smelling breath or sweat, nausea and vomiting, severe dry mouth, trouble breathing, weakness, pain in the abdominal area, confusion, coma. Blood sugar spike causes. Blood sugar level fluctuate all day long. When you eat food, particularly those food that are high in carbohydrate like bread, potatoes, or pasta, your blood sugar will immediately begin to rise. If your blood sugar is consistently high, you need to talk to your doctor about improving your diabetes management. Blood sugar rises when you are not taking enough insulin. Your insulin is not lasting as long as you think it is. You are not taking your oral diabetes medication. Your medication dosage needs adjusting. You are using expired insulin. You are not following your nutritional plan. You have an illness or infection. You are using certain medication like steroids. You are under physical stress such as an injury or surgery. you are under emotional stress such as trouble at work or home or with money problem. If your blood sugar is usually well controlled but you are experiencing an unexplained blood sugar spike, there might be a more acute cause. Try keeping a record of all the food and drink you consume. Check your blood sugar level according to your doctor recommendation. It's common to record your blood sugar reading first thing in the morning because before you have eaten, and then again 2 hours after eating. Even a few days of recorded information can help you and your doctor discover what's causing your blood sugar spike. Now, the common culprit include carbohydrates. Carbs are the most common problem. Carbs get broken down into glucose very quickly. If you take insulin, talk to your doctor about your insulin to carb ratio. Fruits. Fresh fruits are healthy, but they do contain a type of sugar called fructose that raises blood sugar. However, fresh fruit are a better choice than juice, jellies, or jams. Fatty food. Fatty food can cause what's known as a pizza effect. Taking pizza as an example, carbohydrate in the dough and sauce will raise your blood sugar immediately, but the fat and protein won't affect your sugar until hours later. Juice, soda, electrolyte drinks, and sugary coffee drink, these all affect your sugar, so don't forget to count the carb in your drink. Alcohol. Alcohol raises blood sugar immediately, especially when mixed with juice or soda, but it can also cause low blood sugar several hours later. Lack of regular physical activity. Daily physical activity help insulin work more effectively. Talk to your doctor about adjusting your medication to fit your workout schedule. Overtreating low blood sugars. Overtraining is very common. Talk to your doctor about what to do when your blood sugar level drops so that you can avoid huge swings in blood glucose level. Now, 7 ways to prevent blood sugar spikes. Work with a nutritionist to develop a meal plan. Planning your meal will help you avoid unexpected spikes. You might also want to look at the Ultimate Diabetes Meal Planner from the American Diabetes Association. Start a weight loss program. Losing weight will help your body use insulin better. Try the Weight Watchers online program. Learn how to count carb. Carb counting help you keep track of how many carbohydrate you are consuming. Setting a maximum amount for each meal helps stabilize blood sugar. Check out this carb counting toolkit and the complete guide to carb counting from the ADA. Learning about the glycemic index. Research shows that not all carbs are created equal. The glycemic index measures how different carb may affect blood sugar. Food with a high glycemic index rating can affect blood sugar more than those with a lower rating. You can search for low glycemic index foods through glycemicindex.com. Find healthy recipes. Check out this collection of recipes from the Mayo Clinic or buy a diabetes cookbook from the ADA. Try an online meal planning tool. So that's all about the diabetes in this video. I hope you all liked it. For all of you, I prepared a small presentation that will be going to share in the description box below. You can check it out from there. So this is all. Before signing off, I would like to request you all, please do like, share, subscribe this video with your loved ones so that they will also get to know better. So this is Carrie and this is signing off. We will definitely meet in the next video. That's all. Till then, please do take care of your health. God bless you. Bye bye and take care.